The new year brought an end to tax credit subsidies that helped more than 24 million people pay for their health care coverage. The big benefit that made Affordable Care Act insurance premiums more affordable ended when the clock ran out on New Year's Eve. Fox 4's Sean Rabb in the newsroom with more. Sean?
Yeah, 24 million people nationwide, more than 4 million by some estimates right here in Texas. Now all waiting to see if they'll be able to afford health care insurance that they currently have through the Affordable Care Act.
I think there's going to be a lot of folks, particularly in the Dallas area, that are really going to struggle with these increased premium amounts. We're probably not even fully understanding that just yet because of how complicated this is.
Complicated by how individual premiums are calculated, says Dr. John Carlo, CEO, Prism Health, North Texas.
It's very individualized and very specific to each individual's household income, how old they are, and where they live in the state.
Premiums made affordable by government tax credit subsidies that expired at the end of December, with Congress taking no action to fix health care costs, and uncertainty about what your new higher premium will be.
They may not have gotten the premium notices yet because those actually have yet to be fully calculated. So I think the real surprise, unfortunately, is going to be when you first get that first monthly invoice.
Dr. Carlo says most impacted will be middle-aged and middle income. Folks 50 to 64 who earn between $60,000 and $80,000 a year.
You know, these are small business owners, people that work for employers that don't offer health insurance. These are the folks that we think are going to have the biggest impact in getting those premiums paid for.
If your insurance is through the ACA, now is the time to log into your account and check your cost. Maybe consider choices if you need to change plans, but a less expensive plan may also come with less benefit. And you might be able to switch to a different plan before January 15th.
It's definitely a good idea right now where there's still some opportunity to check that premium amount and make sure it's something that you can expect to afford or try to get your coverage changed. But it's going to get harder and harder as we go out through this year if they don't make any changes on the premium subsidies in Congress.
Dr. Carlo worries some will make the hard choice of going without health insurance.
The big fear that we have is that people will delay care, and that's going to result in more costs down the line.
Of course, Congress could still act when lawmakers get back from their holiday break and vote to extend the tax credits until a better plan is delivered. That would be the break millions across the country and in Texas are hoping for.
All right, that's Sean Rabb in the newsroom. Sean, thanks.